Welcome to the podcast. I'm your host, Jim Jorgenson, and today's guest is Dr. Brianne Bakken, and our primary discussion topic is going to be the National Pharmacist Workforce Study. So welcome, Brianne.
Thanks, Jim. Delighted to be here. Appreciate you guys having us on your podcast.
Absolutely. And to get us started, can you share with the audience a little bit about your career history? What are you doing now and how'd you get there?
Absolutely. Happy to. So Jim, I think it's interesting, and I'm sure many pharmacists have similar stories. The path that I found myself on is certainly not the one that I set out on or ever thought that I'd be on, but I think it's been beautiful nonetheless. So growing up in Iowa, I always knew I wanted to go to the University of Iowa. So I first went there for undergrad and then for pharmacy school at the University of Iowa. Following that, I went on to complete a 2-year PGY1, PGY2 health system pharmacy administration residency at the University of Iowa Hospitals and Clinics. And with that came a master's in health administration, also at the University of Iowa, but at the College of Public Health. And, I think during my HSPAL residency, like many residents in that program, I really thought that I wanted to be a chief pharmacy officer or potentially go on to be a hospital CEO potentially. And, as residency progressed, I found I really loved what I was doing. I loved working with people and leading projects, leading teams, working with data, and ultimately ended up taking that in a different direction. So I had the opportunity coming out of residency to be a founding faculty member at a new school of pharmacy in Milwaukee. And that just seemed like an opportunity I couldn't pass up. It might not be one that ever comes again, to see a new school of pharmacy from the ground up and be a part of building all the different aspects. So I got to take everything I learned and was able to do in residency and really apply that in a new way. So still working with people, teaching, still leading projects and getting to build a lot of really cool things. And then, of course, the topic we're talking about today, the data side of it, now using that from a research perspective and thinking about it that way. So after residency, worked as a faculty member in Milwaukee for a number of years. And more recently in 2023, I had the opportunity to come home, if you will. So I'm now an associate professor at the University of Iowa College of Nursing. So you can see I'm kind of making my way across the University of Iowa campus, across the different health colleges, but really enjoying it there in my role at the College of Nursing. I am teaching in their health systems administration and executive leadership master's and doctorate program. And really both of those programs are designed to help grow nursing leaders that want to go out and become a chief nursing officer or a nurse executive in hospitals, health systems, and other healthcare organizations. So again, a great way to apply everything I learned in my health system residency, but now preparing the future generation of nurses.
Thank you. Tell us a little bit about how you got involved with the National Pharmacist Workforce Study and maybe who else is on that research team with you.
Yeah, absolutely. So it's kind of a fun story, actually. I think this story highlights, at least from my perspective, I think it highlights many of the things I love about our profession in pharmacy. It really shows how pharmacy is such a small world where everybody seems to know everyone and we all are willing to help one another and collaborate. So when I took my first faculty role in Milwaukee, the question came up of what's my research area or an area of focus going to be? I spent a lot of time thinking about that. And what kept coming up or kept bubbling up to the surface for me had a lot of questions about our workforce, whether that was what's going on in hospitals and health systems to what's going on with female pharmacy leaders. And I kept circling back to Sarah White's papers on the pharmacy leadership crisis and really wanting to know more about trends in leadership training, but then also that aspect of female leadership. So I actually stumbled across the National Pharmacist Workforce Study, or as we talk about it today, I'll probably refer to it as the NPWS. So I stumbled across the NPWS, started reading through it, and I thought they might actually have data that I could use for a study of women in pharmacy leadership. And when I scrolled to figure out who the researchers were so I could contact them, lo and behold, it was one of my faculty from when I was a student at the University of Iowa College of Pharmacy. So Bill Doucette is a member of that research team. So I reached out to Bill and we had a nice phone conversation. I asked him about the study, if it might be possible to get a hold of some of that data. and kind of took a risk at the end of the call and asked if there was any chance that they needed any help or there'd be a way for me to help join or collaborate with them. And as luck would have it, they were actually looking to bring on some younger faculty to kind of help carry the torch or a new generation. So I actually joined that team in 2017, and the first study that I worked on was our 2019 study. And just talk about an incredible group of faculty. So we call ourselves the Midwest Pharmacy Workforce Research Consortium. And this group of faculty, again, I joined in 2019, but they've been working on this project or this series of studies since 2000. And it includes myself and Bill Doucette at the University of Iowa, Dave Mott and Dave Kraling of the University of Wisconsin, Caroline Gaither and John Schomer of the University of Minnesota, and then Vibhuti Arya of St. John's University. So mostly Midwest or folks that have a Midwest connection, but it's been a stellar group to be a part of, great mentors, lots of great conversations and ideas that are all brought together when we put the study together every time.
That's great. I mean, it really highlights you never do know which path is going to pop up, and you're ultimately going to find yourself on.
Absolutely.
So, just following up on the study, could you touch maybe a little bit more on the funding for the study?
Absolutely. So the National Pharmacist Workforce Study is funded by the Pharmacy Workforce Center, or PWC. And that is a nonprofit coalition that has representation from many other pharmacy organizations. So that would include AACP, APHA, ASHP, and so on. And they've been a really great collaborator for us and a partner for us for all of the different national pharmacy workforce studies that we've conducted. And just to kind of share a little bit more about the National Pharmacist Workforce Study, as I alluded to earlier, it's been conducted for a number of years now. So it's been conducted for approximately every 5 years since 2000, and then most recently in 2024. So we're nearing that 25-year mark, which I think is pretty incredible. And in addition to those studies every 5 years, we did also do a study, what we would call off cycle. And that was in 2022 when we partnered with PwC to do a study specifically looking at the impact of COVID-19 on pharmacists. But in general, our kind of main studies from 2000 and beyond, we try to use a core set of questions that allow us to track and trend things over time. But then in addition to that, we also infuse new questions into each iteration that allows us to explore different topics that might be relevant in the pharmacy profession at that time. So always trying to stay abreast to what we're hearing from our colleagues or seeing in the news and media, and then trying to look and actually study that or have data to support the prevalence of what we're hearing anecdotally. In terms of how it's actually conducted, there's lots of good stories out there of talking about the original NPWS studies, and those are actually conducted as paper surveys that went out in the mail. And then you can imagine the amount of work in taking those mail surveys and then uploading them and transcribing them. So I was very fortunate when I joined the team for the 2019 study. That was the first time we actually made the transition to an online Qualtrics-based survey, which is what we used 2019, 2022, and then most recently in 2024. And in order to send that survey out electronically, we've partnered with the National Association of Boards of Pharmacy. And we work with them to pull a random sample of pharmacists, and they actually send the survey link out using their platform and are able to give us good analytics about who opens the email, who clicks it, and then we look to see who actually completes the survey to get our response rate. And then ultimately, we compile all of our data into a final report and an executive summary, which you're probably familiar with. And those get posted on the Pharmacy Workforce Center website, which is hosted through AACP. And in addition to those reports that we put together, our research team will also conduct additional studies and write manuscripts, usually looking at a specific population of pharmacists or a very specific topic that we want to dig in and analyze a little bit deeper.
Yeah, I know one of those studies was published from the 2019 survey, and it was your paper titled An Intersectional Review of Discrimination and Harassment Experiences in Pharmacy. And In fact, that paper did receive the 2023 American Pharmacists Association Widerholt Prize, which does recognize the best published paper in the Journal of the American Pharmacists Association that describes original investigation in economic, social, or administrative sciences related to pharmacy. So can you tell us a little bit about that work?
Absolutely. So the study that you're referring to, using our data from the 2019 National Pharmacist Workforce Study, was really a passion project of mine, and definitely something I'm really proud of, and was excited to see it recognized by APHA in the Wiederholt Prize. So soon after I joined the team in 2017, we were really starting to think about what we wanted to do with the 2019 survey instrument, making that transition to the online platform, but then also thinking about those new questions or new topics that we might want to infuse. And for me, coming on board, some things that were really going on in our environment that I was thinking a lot about in 2017, you'll recall this was right when the Me Too movement was really picking up speed and gained global attention. And then soon after, in 2018, Black Lives Matter was a social justice movement that was also really picking up speed and gaining a lot of attention. So I think for me, this really brought up a lot of conversations and thoughts around discrimination and harassment and what might be occurring in pharmacy. So when I went to go look and see what was available in the literature, there really wasn't a lot on this topic specific to pharmacy. So I was only able to find a couple of studies, and none of them were national studies like we're able to conduct through the NPWS. But I was able to find two state-specific surveys where they surveyed pharmacists in Illinois in one study in 1996 and another study in Ohio in 1999. And both were asking about experiences of discrimination or harassment. And I think what really stood out to me in those two studies was the lack of reporting. So pharmacists did say that they had experienced discrimination or harassment, but then they didn't really have a mechanism of reporting it, or they felt like if they reported it, nothing was going to happen. So it wasn't worth the effort. So I brought this back to our team, and we decided that it would be a really great thing for us to study in a more modern time. So that was, both of those were done in the early 90s. Now, fast forward almost 2020, felt like a good time to revisit the topic, and then also on a national scale. So we infused a new set of questions asking about, again, experiences of discrimination and harassment. We also asked about who the offender was. So was it a colleague? Was it your supervisor, patients, et cetera? And then we also asked about, did they report it? Why or why not? And I think the other thing that was really at play for me around this time, I had been reading about the concept of intersectionality, which was first introduced by an African-American feminist, Kimberly Crenshaw. And I had been reading a lot of her studies and her work. And really the idea of intersectionality, it's really recognizing that we all have multiple identities, and the multiplication of those can really change the experience one might have. So I knew that that was a construct that I really wanted to look at once we got this data back. So the paper that you're referring to, we used that intersectional approach where we looked at pharmacists' experiences based on both their gender and their race combined to see if those different groups had different experiences. And there certainly were wildly different experiences based on gender and race. I think what really stands out to me as a kind of a pivotal concept from all of this was also who the offender was. And that's something that I've just certainly carried forward with me and in different talks that we've given across the country. And the most common offender involved in harassment specifically of pharmacists was actually patients and customers. And I think once you hear that, maybe it's not overly surprising, but at the time it was. That was really before COVID, which I think really amplified this idea of these poor patient experience or interactions that healthcare providers might have. So when you think back to this and rewind to 2019, when we were having conversations about harassment from patients, there really wasn't a lot being done in the healthcare organizations or the pharmacies to address that or have a policy in place for what to do when that happens. So the thing that I think about, and if you've worked in a large organization or if you work in a pharmacy, you go through these trainings about what to do when discrimination or harassment occurs, but it's usually when that occurs from a colleague or your supervisor. And there's, trainings to help prevent that from happening and then how to handle it. But again, at the time, there really wasn't a lot in place for what do you do when it's a patient? And will the organization stand up for you? And I will say that I think, now bringing it back to present state, a lot has happened, both, I think as a result of our study and others. And then again, this really coming to light during COVID. And I think I've seen more and more hospitals and healthcare organizations with patient behavior policies that are outwardly saying that, they're not going to tolerate patients mistreating their healthcare providers. But if you rewind back to 2017 or 18, that certainly wasn't the case or not commonplace.
Is this something that you're going to be taking a look at again with the current survey?
Yes, we are using a new instrument or asking questions in a different way using the new NIOSH WellBQ, which I'm sure I'll get a chance to talk a little bit more about. But we are going to continue tracking experiences of discrimination and harassment moving forward. But this new instrument will allow us to better compare with other professions that might also be using that same instrument.
Moving to the 2022 survey, I think one item that gets a lot of attention is pharmacist burnout. And, pharmacist burnout consisted of work exhaustion and interpersonal disengagement. And overall, responding pharmacists reported moderate levels of work exhaustion, but less interpersonal disengagement. And respondents practicing in small chain and independent pharmacies had the highest level of professional engagement and lowest levels of work exhaustion and interpersonal disengagement. And the opposite was reported for respondents working in large chain, mass merchandiser, and supermarket pharmacies. And respondents working in hospital inpatient pharmacies kind of came in the middle. Any surprises or concerns with these results?
First thing I'll say is, unfortunately, I'm not surprised based on the data that we've seen both then and we continue to see, but I certainly find it very alarming. I think broadly, the largest practice setting for pharmacists continues to be in the community setting. And within community, when you look at our reports, the large chain, mass merchandiser, supermarket area is the largest area where we have practicing pharmacists. So really trying to think about that group, our largest group of pharmacists, how do we protect them, keep them safe, keep them satisfied, and prevent them from burning out, I think is really critical. I think in terms of the results not surprising me, again, I think it's really unfortunate, but the unfortunate reality is that work environments in these large chain settings simply aren't good. You've got pharmacists working long hours, often as the only pharmacist, with no breaks, no support, no control over the decisions that are being made that might influence their work. You also now have the added stress of a technician shortage, so not having additional support staff to help run the operations in these chain environments. And I think when we look at our data, what we find is that pharmacists in large chains typically report higher workload ratings, higher stress levels, and of course, as you've alluded to, have more indicators of burnout. So I think we really need to, as a profession, try to figure out what we're going to do to address this concern. And I think from my own perspective, what I commonly see is when we think about burnout, much of the efforts so far have been really putting the onus on the individual and saying, hey, here are things the individual pharmacist can do. You can have better sleep patterns, practice mindfulness, get more physical activity. Here are some coping skills. And those are all well and good, but it's really not getting at the root cause of the problem. And I think when we really drill down and think about burnout, it's a job-specific phenomenon. What does that mean? We get burnt out because of work. It's what happens at the work environment. And it's usually associated with our job demands and the work environment itself compared to the resources and the rewards that are available. So I really think in this topic, as we talk about burnout, we really need to start thinking about how we're going to fix those work environments. And that really needs to start thinking about how pharmacy leaders and organizations can prioritize pharmacist well-being and fixing those work environments.
Couldn't agree more. And, I think the pandemic obviously influenced the 2022 survey. And in addition to burnout, any lingering impacts from the pandemic that you're concerned about or are going to pay particular attention to in your future studies?
Yes, absolutely. I think many of the topics that we've talked about so far, especially in this last conversation we were just having about pharmacist burnout and work environments, these are definitely things we're carrying forward into the 2024 study. And thinking about 2022, when we thought about the impact of COVID, some of the new questions that we implemented in 2022, we're looking at employment status changes. So were pharmacists moving around more than they had in the past? And if so, how often? What types of changes were they making? So switching from a different employer, taking a new position, maybe even leaving pharmacy for a short period of time or permanently. Those are all things that we carried forward into 2024 and are continuing to look at. And then we also added turnover intentions. So employment status changes are looking in the past, have you recently made a change? And then our turnover intentions instrument is looking at how likely is it that you'll make a change in the next 1 to 3 years. So again, we're asking very similar questions about changing positions, changing employers, practice settings, leaving the profession, considering retirement. So all of those are things that we're carrying forward into 2024 to look at as well. And then we really wanted to focus in 2024 on this idea of pharmacist well-being and work environments. So one of the things I alluded to in a previous conversation we were just having is the NIOSH WellBQ. And this is a new instrument that just came out not that long ago. And the idea was to help operationalize the NIOSH Total Worker Health Program. And really, total worker health is a new paradigm thinking about workers' safety, health, and well-being in a more holistic manner. And so we really wanted to use that instrument within the 2024 study and using it to help dig into the organizational and using it to dig into the organizational factors in the work environment specifically and how those contribute to pharmacists' well-being.
Since you and your team are actively working on the 2024 study, what can you tell us about the project and what we might be able to look forward to?
So the 2024 National Pharmacist Workforce Study, as you mentioned, we're right in the thick of it. So we conducted the study from November 8th until December 15th of 2024, so right at the end of this past year. And now we're in the middle of analyzing our data and putting together our final report, which we anticipate will be published in June of 2025. So here in the next couple of months. I think a few things I want to highlight from the 2024 study. We took a different approach in this iteration. And what we've done in this time is we've taken a core set of questions, our typical ones that we've used in the past, or ones that we wanted all pharmacists taking the survey to get. So that included demographics, things like your employment status, practice setting, the hours that you work, your education and training, the NIOSH WellBQ instrument that I just talked about. And then we added some new questions, what I'm calling the pharmacy perceptions. So we added questions about how proud do you feel to be a pharmacist? Would you recommend pharmacy as a good career or profession? And if given the chance, would you go back and do pharmacy over again? So those are some of the things that we've included in what we're calling the core survey that everyone got. But in an attempt to try and make the survey shorter for our respondents, we actually had 3 different supplements. So a participant would complete the survey and then get sent to one of those 3 supplement areas. And each of those had a different theme. So our 3 supplements for 2024, those areas were employment status changes and turnover intentions, which we just talked about here a few moments ago. We had supplement 2 on work activities. And then supplement 3 was career perceptions. And this was really looking at when you think about where you're at in your career, do you think you're ahead or behind of where you thought you'd be right now? We also added some questions in that supplement about involvement in pharmacy organizations and if they feel like that helps support them or brings value to their career and a few other things. So to kind of pull this all back together, again, we're actively working on analyzing our data, and I think we're going to have some really great things to share and report. And I think I can share a few of those with you now. I don't want to give it all away, but there'll be a lot in the report for folks to look at. But some of the ones that I think I find most interesting are really looking at that NIOSH WellBQ. And we did not include all of the items from the WellBQ. It's over 100 items, some of which we had already been asking using our own survey instrument. So we kept some of that, but we did try to infuse some across the 5 areas of pharmacist well-being. So within the NIOSH instrument, that included work evaluation and experience, workplace policies and culture, workplace physical environment and safety culture, pharmacist health status, and then home, community, and society. And I think a few things that I'll share with this group as kind of a teaser for what's to come. One of the questions we asked about in this category of work evaluation and experience was the idea of overall job satisfaction. And what we found, again, across all pharmacists, from actively practicing pharmacists across practice settings, 69.5 said they were somewhat or very satisfied. So right around 70%. Not bad, but not great. And when we really dig into that, I think where it gets really interesting is looking at the differences by practice setting. So the group with the highest overall job satisfaction was in the other setting, and then in the ambulatory care setting, which was at 81.8%. Hospital and health systems, 79.5%. So above average or above the whole. And then community pharmacy, this is where it drops off. And you alluded when we talked about burnout, we like to look at differences between independent pharmacy versus that chain environment, because we do know that those are different. And so when we look at overall job satisfaction in the independent and small chain environment, it's at 75%. So quite a bit closer to hospitals and health systems. And where it really drops off is when we look at the large chain supermarket mass merchandiser group, and that's where it drops all the way to 53%. So only half of pharmacists in that setting are satisfied. So I think this is something we really need to grapple with. And when we dig into this a little bit further, so in addition to overall job satisfaction, we asked about their level of satisfaction with compensation and benefits, which were both right around 70%, again, across all practicing pharmacists. But where we saw a pretty significant decline is in their opportunities for advancement and promotion. And this dropped down to about 57.6%. So again, just a little over half of pharmacists were satisfied with their opportunities. So I think this really reflects some of the things that, at least in the health system environment, I know there's a lot of discussion about pharmacist career ladders and opportunities to advance within that environment. And I think we need to have more conversations and more action around that. I think the other thing that I'd like to highlight, again, kind of tying all of this together around pharmacist well-being and their overall satisfaction. When we dig into the next section of the NIOSH WellBQ, which is focused on workplace policies and cultures, I pulled just a few things that I found interesting. I think overall, pharmacists had pretty high levels of satisfaction in a number of areas, but I wanted to pull out the ones that I found most alarming or concerning as maybe some areas and opportunities for improvement. So the items where pharmacists were right around that 50% mark, again, either not satisfied, but maybe not dissatisfied, areas where we could improve. My organization cares about my satisfaction at work, 50%. My organization is willing to extend resources to help me perform to the best of my ability, 50.6%. I trust the management and leadership in my organization, 51.2%. And I receive recognition for a job well done, 56.1%. So I think these are all notable as, again, some areas that we could be doing a better job. And I think it highlights, again, the organizational side of the equation. How can we help strengthen the bond between frontline pharmacists and their pharmacy leaders in the organization so that they feel they can trust their leader, that they're accessible, that their leader in the organization cares about them, and that they're recognized for the hard work and the important work that they do.
Excellent. Maybe taking a macro look, since you've been doing this for a while, what are some of the most interesting or concerning trends that you've observed during your time working with the survey?
I think some of the more concerning elements or trends are ones we've already talked about. I think the areas of pharmacist burnout is definitely something that's been top of mind for me for quite some time. And again, now really kind of shifting gears and thinking about organizational factors and those poor work environments. I think that's certainly something that's very concerning and something we need to start figuring out how we're going to address from an organizational level. I think the other one that really stands out, and it's not specific to pharmacy per se, but in that excuse me. The other one I think that really stands out, and it's not necessarily specific to pharmacy, but it is very, very much important to us. And that's going to be this trend of student loan debt. This is something our group has asked about, I believe, all the way back to 2000. We asked about pharmacist student loan debt at the time of graduation versus what it is at the time they take the survey, and trying to look at how long it's taking them to pay that off. And then more recently in 2024, we added some new questions about how they feel about that debt, whether or not it causes stress, how long they think it's going to take to pay it off, so on and so forth. But I think this is something as a profession we really need to be mindful of, the cost of going to pharmacy school. And, I think where this really becomes concerning is there's so many other health professions out there that, yes, it may cost just as much, but the earning potential or the time that it takes to graduate is less. So really thinking about that return on investment of going to pharmacy school and what can we do to help lower that debt burden for pharmacists.
Yeah, most definitely a consideration. With all the data in the survey, you also published a paper addressing non-response bias when interpreting the survey results. What were your conclusions there?
So the paper from 2019, one of the main reasons for putting together this manuscript in 2019, that was our first iteration where we made that transition from paper-based surveys to the Qualtrics survey. So we really wanted to analyze those methods and then look at how that changes or what that meant for who responds to the survey versus who would have responded to a paper-based survey. I think a couple really important things to highlight with regards to that paper and just the response to the National Pharmacist Workforce Study overall. I think it's important to remember that the data from the NPWS is not representative of the entire population. Unfortunately, our data is only as good as who fills out the survey. So when we're reporting data, it's based on who responded to the survey, which is why our assessment of response rate and response bias is always going to be something that we're thinking about, and in this instance, trying to write about and share openly. What we found from the 2019 manuscript on our assessment of response bias and the methods, it was mixed. I think overall, the positive side of this, switching to the online survey, resulted in the largest usable sample or the largest usable responses of any of the NPWSs that had been conducted since 2000. So we had a really large sample of pharmacists, which is great. So the Qualtrics was really good from that perspective. However, we also had a low response rate. And part of this, I think, is the nature of email. It's still something we continue to grapple with today. How many emails do you get that just go unopened, or they make it to your junk and never get opened? So one of the things we talk about in that paper and we still look at now is not just how many people got the email, but looking at click rates, how many people opened the email versus how many clicked on the survey link. And I think what we found is if they open the email and click the link, there's a very high likelihood that they're going to finish the survey. So we use that as another surrogate when we're looking at overall response rate. But I think moving forward, our assessment of response bias is always going to be important. It's always something we're going to be looking at. And I will say that moving forward, we're going to continue to look at that for 2024. We already have plans in the works and are working on a manuscript to summarize our assessment of potential response bias in 2024. From looking at the data so far, we can already say that there were fewer younger pharmacists responding to the 2024 NPWS than in previous years. We also had fewer hospital-based pharmacists than we have in the past, and a higher number of retired pharmacists. And all of those, I think you can come up with, rationalization for why younger pharmacists maybe are less likely to be checking their email or less likely to be familiar with the NPWS or its value. If you're a retired pharmacist, you probably have a little more time on your hands and maybe you're willing to sit down and fill out a survey. But I think our team, again, as we're writing this paper, we're also trying to think about the future of NPWS and maybe what could we be doing differently. And our team has already come up with a variety of different ideas for what we might do in the future to better engage pharmacists and hopefully potentially increase our response rate. And some of those things we've thought about include conducting shorter, maybe more topical, like a pulse survey model, where rather than waiting 5 years and doing a large survey, maybe we're sending out smaller pulse or topic surveys more frequently. We've also talked about the idea of leveraging social media, which we have not done in the past, part of which becomes really hard to come up with a denominator for your response rate. If you share the link with anyone, A, it's hard to confirm if they're a pharmacist or not, and then B, how many people potentially saw that to know what your response rate is. So something we're grappling with, and maybe the benefits outweigh the risks. The other one that we've talked about is potentially trying to partner with either state boards of pharmacy or pharmacy organizations to try and disseminate the survey in a different way rather than through the NABPF. I will say that in looking at some other professions and how they study workforce, in some states, the licensing board actually requires individuals to complete a survey when they renew their license. So again, having almost 100% response rate for all of the licensed individuals in that state would help eliminate some of the response bias or non-response bias that we've grappled with in the past.
Maybe expanding on that just a little bit. I mean, how important is it for the profession to get as many pharmacists as possible engaged with survey response?
I mean, I think this is absolutely critical. Again, as I alluded to earlier, our data is only as good as who responds to the survey. So that means we need a large representative sample, which includes younger pharmacists all the way through older pharmacists, pharmacists that are actively practicing and those that maybe say they're not practicing as a pharmacist and they've taken on roles in leadership or in other areas. But all of that comes together to tell us about the group of pharmacists, what they're doing, how they care about their work, what they're dealing with. And again, that really relies on a large number of people taking the time to fill out these surveys. And I think when you think about, what's the importance of this study, and I know one of the questions that often gets asked is, what's in it for me? Why would I fill out this survey and take my time to do it? And the reality is this study is one example that gives pharmacists a voice. It's a way for them to share those things, who they are, what they're dealing with, what they care about, what they'd like to see changed. And they're doing that on a national scale. So our reports and our data, they really are a mechanism for magnifying workforce concerns like burnout, work environments, student loan debt. It also helps generate conversations about the future. What could we change? What could we be doing differently? And it helps us advocate for our profession, whether that's in our organizations about raises or making changes to work environments, but also advocating and lobbying for changes at a state or national level.
I could probably keep going on this topic for the rest of the afternoon, but I do want to be respectful of your time. Any last thoughts on the study you'd like to share?
I think there's, just like you, Jim, I could talk about pharmacy workforce for hours. But I think the big thing that comes to my mind, I want to use this as an opportunity for anyone who's listening to the podcast. If you've ever completed one of our NPWS surveys, whether it was 2024 or all the way back in 2000, I just want to thank you. Again, we really cannot do this important work without our pharmacists and them taking the time to fill out our survey. And I would also encourage all pharmacists in the future, if you receive an email from us in the future, please do take the 10 minutes to fill it out. Your perspective, your voice really matters, and we can't do it without you. And otherwise, Jim, I just want to thank you and thank Visant for allowing us to be featured on the podcast and hopefully help spread the word about the National Pharmacist Workforce Study.
Great information today. And Bree, thanks for being on the show and sharing your experience with the National Pharmacist Workforce Study.
Thanks, Jim.